Welcome to Preparing Your Best EIS Application, applying to become a CDC disease detective in the Epidemic Intelligence Service. Welcome. I am looking forward to sharing with you today information on CDC's Epidemic Intelligence Service, or EIS. My name is Rocky Rodriguez, Selection Lead for the Epidemiology and Laboratory Workforce Branch. In this webinar, we'll walk through an overview of the program and discuss the application process. I'll give a few tips for a competitive application. This webinar will cover a little about what is EIS, but it's more geared to those who already know they want to apply. EIS is the world's longest-running field epidemiology training program. It is a 2-year competency-based service learning fellowship where EIS officers serve on the front lines of public health, protecting Americans and the global community while training under the guidance of seasoned mentors. When disease outbreaks or other public health threats emerge, EIS officers investigate, identify the cause, rapidly implement control measures, and collect evidence to recommend preventative actions. EIS disease detectives come from a variety of disciplines with an interest in field experience and a passion for service. Past EIS classes have included doctoral level scientists, nurses, physicians, veterinarians, and other doctoral level healthcare professionals. Pictured here is Howard Chio, EIS class of 2018, who presented an outbreak investigation at the 2019 EIS conference in Atlanta. He was assigned to work in the Los Angeles County Public Health Department during his fellowship. If you think of a major public health event or emergency from 1951 to present day, CDC and EIS were there. From smallpox to HIV/AIDS to anthrax, and more recently with the COVID-19 pandemic and mpox. EIS officers train and provide service to state, tribal, local, and territorial health departments, working alongside local public health staff and at CDC headquarters. EIS officers work across the United States. Many positions are in Atlanta at CDC headquarters, but others are at non-Atlanta CDC campuses and at state, tribal, local, and territorial health departments. If you are selected for EIS, you are required to live near your duty station. You must be willing to live and work in Atlanta, Georgia, or in a variety of field locations. This image depicts class of 2023 officers Kimberly Gressick and John Lee as they were extracting information from hospital records to characterize a Chicago, Illinois overdose outbreak. Regardless of whether assigned to field or to CDC headquarters, EIS officers are CDC employees who have unparalleled training and career opportunities. Officers are supervised and mentored by epidemiologists, often EIS alumni themselves who are experts in their fields. Officers get to work as part of interdisciplinary teams to detect and respond to new and ongoing public health threats. Pictured here is Amin Ben Hamida, class of 2017. He traveled to Burkina Faso on an EPI-8 to strengthen severe acute respiratory infection sentinel surveillance ahead of the influenza season. Most alumni continue working in public health and are leaders in the field. For example, EIS alumni assume key leadership roles in state, tribal, local, and territorial health departments. As of 2024, 34% of U.S. state epidemiologists were EIS alumni, and 45% of U.S. state public health veterinarians were EIS alumni. Many previous CDC directors and leaders are also EIS alumni. Pictured here is class of 2022 officer Keisha Lindsay Nurse as she presented a TED-style talk about the impact of homicide within Black communities at the 2024 EIS conference. Let's pivot to discussing the application and selection process. The entire process begins with eligibility. If you are not eligible, your application will not be reviewed. EIS has specific degree, licensing, and experience requirements for clinicians and doctoral level scientists. In most cases, a master's level degree alone, such as an MPH, does not meet the eligibility requirements. We will send you an eligibility determination email after initial review of your application to let you know if you are deemed eligible. Again, please check the requirements on our website before taking the time to pull together your application. If you still have eligibility questions after reviewing the eligibility criteria on our website, please email eisapplication@cdc.gov. To be eligible for EIS, you must be a doctoral level scientist or be a clinician, that is, a physician, nurse, physician assistant, veterinarian, or other doctoral level healthcare professional. Active, unrestricted U.S. clinical licenses are requirements for all clinicians. If you're applying as a doctoral level scientist and have not received your degree, you must defend your dissertation before March 31st of the year the program begins, also known as the class year, and be able to provide a transcript or proof of defense letter by this date to be eligible, by the March 31st date. If accepted to the class, your degree must be fully confirmed and your transcript available by June 1st of the class year. Please note that non-U.S. citizens have additional requirements, including being eligible for a J-1 exchange visitor visa in the research scholar category at the time of application and remaining eligible for a G-1 visa, and English language proficiency evidenced by qualifying TOEFL scores, unless exempt as outlined on our webpage. As a reminder, all applicants applying as clinicians must have an unrestricted U.S. clinical license to practice their clinical specialty, regardless of citizenship. Non-U.S. clinical licenses will not be accepted. When applying, please make sure you have uploaded transcripts for all conferred or in-progress degrees that are listed in your application. Transcripts can be unofficial. If you are accepted to the EIS program, you will have time to submit your official transcripts that Human Resources needs for your hiring package. Applications without transcripts are incomplete and will not be reviewed. If your transcripts are not in English, they must have an accompanying equivalency report. Your application cannot be reviewed if the proper transcript documentation is not submitted. Equivalency reports are also needed for international doctoral programs that do not provide transcripts. A scanned copy of your doctoral degree diploma is not sufficient. Please email eisapplication@cdc.gov if there are questions or issues. Now we'll give an overview of the selection and match processes, followed by tips to improve the quality of your application. The first step is to submit your application online. Access the application portal through the EIS website. Be sure to confirm the selection timeline and due dates on the EIS website. We select incoming officers first and then match them to positions. Your applications are first reviewed for eligibility. Your application will be rejected if it doesn't meet eligibility requirements. After eligibility review comes the full application review and scoring of your application, your education, experience, and standardized letters of recommendation, etc. Applicants with high scoring applications advance to interviews with the EIS program. All interviews will take place virtually. The EIS website has timeline details on when applicants should expect to hear about interviews and when interviews take place. Your interview day will consist of an interview with a series of structured questions followed by an optional Q&A with program leadership during which you can ask questions. There will also be a simple writing task. Neither the interview questions nor the writing task will require specific knowledge of epidemiology or biostatistics. There is no need to brush up on old academic textbooks before the interview. Your overall application and interview scores are considered to determine whether you are accepted into the class or not. After virtual interviews, you will be accepted into the class, placed on the wait list, or rejected. Class size is budget dependent. Everyone who is accepted into the EIS class will be matched with a position. Most accepted candidates will participate in the regular match process, which occurs at the time of the EIS conference in the spring. During the conference, you meet with supervisors, current officers, and other staff to learn more about available positions. You then interview with those positions. A scoring process will take place, and then an algorithm will match you to the position for the 2-year fellowship. As mentioned before, all EIS officers must be willing to physically relocate to Atlanta or to the location of their position. There may also be a pre-match process where accepted and waitlisted individuals can potentially match to priority host sites. Pre-match occurs earlier, typically in the fall. During this time, a select few will match to strong positions that are in an area of high agency need or are historically difficult to fill. Candidates may be selected to interview with pre-match positions, then a scoring process will take place, and an algorithm will match candidates to positions for the 2-year fellowship. Matching to a position during the pre-match will give a candidate the advantage of knowing where they will be living and what they will be doing much earlier than if they went through regular match in the spring. It is important to note that non-US citizens, that is, those on international visas or those with US permanent resident status, cannot travel outside the contiguous United States for EIS. Therefore, non-US citizens cannot match to positions outside the contiguous US. Example, Alaska, Puerto Rico, US Virgin Islands, nor can non-US citizens match to positions that require international travel. Tips for navigating the online application. The EIS application portal was updated in 2024. If you have applied to EIS since 2024, you will already have a profile in the portal linked to your email address. You can apply multiple times using the same profile. If you already have a profile, please begin an application using your existing profile and do not create multiple profiles. Any system can have limitations. Therefore, we recommend typing all your responses into a Word document. This is just to be on the safe side and will allow you to back up your responses for the application. As you are preparing your application, think about the sequence of your experiences. Please enter your education, work experience, and other training details in chronological order so that it is easier for application reviewers to review your experiences and training. When you are uploading your licenses and transcripts, confirm the documents are readable and not locked. If this is not feasible, please contact us at eisapplication@cdc.gov. Follow up with your recommenders to ensure they submit standardized letters of recommendation on time. Our letters are not traditional narrative letters of recommendation. Recommenders must use the standardized letters generated by the online application portal and submit it through the portal. Check back to ensure your recommenders submitted the standardized letter of recommendation by the deadline. You must have an active, unrestricted U.S. license to practice your clinical specialty at the time of application submission, unless you are a veterinarian. Veterinarians must have an active, unrestricted U.S. license to practice veterinary medicine by September 1st of the application year. If you are unable to provide a clinical license at the time of application for any reason, please email eisapplication@cdc.gov as soon as possible. In most cases, you will be required to upload a letter of exemption that clearly states the reason you do not have an active, unrestricted U.S. license to practice your clinical specialty. Examples of acceptable reasons for not having an active, unrestricted U.S. license at the time of application are you are currently completing an ACGME residency or fellowship, or you have a physician training license. All applicants must be able to provide an active, unrestricted U.S. license by the start date of the EIS fellowship. We'll go over a few tips on how to improve the quality of your EIS application. In general, the best applications come from those who took the time to learn about the program, who understand the kind of training they will receive, and who understand how EIS fits with their career plans. This knowledge infuses the application and makes it clear to the person reviewing your application that you know what EIS is about and that you believe EIS is the next best step for your training in a career of public health. I can't emphasize enough how important this is. Learn about EIS. The EIS website is a great place to start. There you will find recruitment videos, news articles, and other informational materials that will give you an idea of the breadth of topics EIS officers work on, the skills you will build as an EIS officer, and what EIS officers do on a day-to-day basis. If possible, you may want to attend the EIS conference held annually in the spring. The conference is a great opportunity for public health partners to network and learn about recent epidemiologic investigations, laboratory science, and forward-thinking strategies to improve public health. This is a great place to learn more about the kind of work EIS officers do and get the opportunity to talk to current and former officers. The conference is free and open to the public. Many of the conference presentations are available virtually, so even if you can't make it in person, you can learn about the work of the EIS officers. Check out our website for information on the conference. Pictured here are officers in the class of EIS of 2023 at the 2023 EIS conference. We think it is important that you know who we are, but you should also make clear who you are. Include relevant training and skills that help tell your story. What experiences have shaped your professional life, and what are the circumstances that inform your narrative? Some combination of your academic training, work experience, and volunteer activities should speak to these points, but your personal statement gives you the opportunity to tie all this together in a cohesive narrative. Take time on your personal statement response. This photo depicts Gemma Alarcon from the class of 2022 as she was being interviewed by a local Los Angeles TV station, Telemundo, in both English and Spanish to inform the public about West Nile virus prevention in June 2023. Another important aspect to make clear in your application is how EIS training fits with where you have been and where you want to go. Let us know why you are interested in a public health career and what you have done so far to prepare and where you want to go. You should also articulate how EIS training will help you do this. Your personal statement gives you the opportunity to tie together what you have listed in the other parts of the application in a cohesive narrative that speaks to this question. Choose recommenders carefully. These should be from supervisors, senior mentors, committee members, or others who have known you well and have worked with you recently. They should not be from colleagues or someone who worked with you many years ago. A poor recommendation or one that is not a suitable source can seriously hurt your application score. Be sure to ask someone who knows you well and is likely to submit the recommendation on time. Pictured here is Class of 2022 Officer Forrest Jones and CDC employee Jessica Irizarry Ramos, reviewing details of the leptospirosis surveillance system after Hurricane Fiona hit Puerto Rico in 2022. Dedicate a good amount of time to complete your application. You can save and resume, and the earlier you start your application and familiarize yourself with the portal, the better it will be. We look forward to reviewing your submission and hopefully welcoming you into the next EIS class. Thank you for listening today. This image depicts Class of 2024 Officer Lieutenant Adiba Hassan, who is talking to middle school students about being a disease detective. To learn more about EIS and becoming a disease detective, check our website. You can also email us at eisapplication@cdc.gov if you have any specific questions or concerns. Thank you.